I'll try to be very brief and will address myself to the question that's actually in the program, which is the implications for this effort for WHO policy. Now, in thinking about WHO policy, I think we could probably break it down into two specific areas. The first one is the work of the WHO Secretariat, and that's the technical arm, you might say, of WHO, whose headquarters is in Geneva. And the second is really the implications for the member states, which actually then forms, you might say, the assembly of countries which are part of WHO. First of all, in thinking about this initiative, which Andrew has actually very elaborately described, I would say two things. I think what we want to achieve here will have generational impact. And I mean generations of professionals as well as of populations. And I guess the second one is eventually you want to have multidimensional and multisectoral effects. In thinking about that then, from the point of view of the WHO Secretariat, if we're to go beyond the concepts and the rhetoric of person-centered care, it really means that eventually the Secretariat must take upon itself to develop in collaboration and maybe fed by this process with a type of technical documents, technical norms that actually are going to then be put in high profile for professional societies, for countries, for different patient groups to actually look at. So in a sense, for the Secretariat, it's that normative or normatizing process of actually embedding this into the WHO technical documents. That Secretariat will include both, or among others, headquarters, the regions, and the country offices. And therefore, it's in a sense embedding all of this knowledge in these different technical groups. So you could think of this process as that process of knowledge generation. The second process would be the implications for member states. And really, when I say member states, we don't think of governments themselves, but you're really thinking of societies. And within those societies, sectors, academia, health services, regulatory agencies, and so on and so forth. And I think within the member state process, it's going to be then the political process of getting member states to make the types of resolutions, the type of declarations that's going to push person-centered care within the agendas of their countries. So that's the implication for WHO. The work within the technical secretariat and the work within the member states. How long is it going to take? It depends on how quickly we move. For example, if you think of tobacco control and the Framework Convention of Tobacco Control, getting the agreement among member states, that was at least a 5-year negotiation process with a lot of work beforehand in terms of the research that actually harked back to the 1950s to make that association between smoking and cancer. But in the end, you can see that from those studies in the 1950s to now, you then have a framework convention and stronger tobacco control that countries are actually buying into. That was a 60, 70-year process, generational. It could be shorter. Recently, WHO, the member states adopted the code, the global code for international recruitment of health personnel, which was really a code, an ethical code, voluntary, which member states agreed upon in order not to exacerbate the shortages in very poor countries as a result of unethical recruitment for health workers. That process started in 2004, and in 2010, the code was adopted by the member states. So a process from as long as 70 years to maybe as short as 6 to 10. You know, it's a world that's accelerating very rapidly. This is an exciting process, and based on the descriptions, it's going to generate a lot of energy, and certainly, I think WHO needs to be engaged in order to get these norms into the countries and personalization of care actually established in a grander form and vision than we have today. Thank you.